Hello dear viewers, welcome back to the channel Basic Home First Aid. Today I'm going to show you how to apply basic first aid to a child who is convulsing at home, how to recognize a convulsion, and some precautions to take for children with seizures disorders. By the end of this video, you will react confidently in such a situation and save a child. Don't forget to subscribe and like at the end. Convulsions, also called seizures, when occurring in young children, is most often the result of raised body temperature associated with a throat or ear infection or other infection. This type of convulsion is known as a febrile convulsion and occurs because the electrical system in the brain are not mature enough to deal with the body's high temperature. Although convulsions can be alarming, they are rarely dangerous if properly dealt with. However, you should seek medical advice for the child to rule out any serious underlying condition. How do we recognize a seizure in a child? Most often, there is a vigorous shaking of the body with clenched fists and an arched back. There may also be obvious signs of fever like hot skin and sweating, possible vomiting, loss of bowel or bladder control, and loss or impaired consciousness. Below are the proper ways to take care of such a situation at home. Stay calm, clear the area and place pillows or any soft material around the child so that violent movements will not result in injury. Do not restrain the child in any way. Make sure you time the convulsion using a watch. If the child's seizure was caused by a fever, cool him by removing any tight clothing, for example t-shirts. You may have to wait until the seizure stops. Ensure a good supply of fresh air, but do not overcool the child. Remember, it is impossible to swallow the tongue, so don't force the mouth open and do not put anything into the mouth. They may bite it out or choke. Once the seizure has stopped, maintain an open airway by placing the patient in the recovery position, that is, making the child lie on one side of the body, and provide reassurance to the child. After the convulsion, if the child can respond to simple questions, allow them to sleep. It is normal to feel sleepy after a convulsion. Bring the child to the hospital for medical evaluation and proper investigations of the cause of the seizure. Note that if the seizure lasts for more than 5 minutes, make sure you call for help and transport the patient to the hospital immediately. Now I'm going to give you some precautions to take for children with seizure disorders like epilepsy. Firstly, ensure the child is never alone. Also, some sport activities which require extreme physical contact should be avoided. Consult your healthcare provider. Swimming is allowed as long as seizures are stable and there is a 1-to-1 adult supervision. The bathroom door should remain unlocked. Driving and machinery should be avoided until it has been 6 months since the last seizure. The child can safely ride a bike but should wear a helmet. So remember, when faced with convulsions in children, clear the area and place a pillow or any soft material to protect the child. Once seizure stops, place the child in the recovery position. Finally, bring the child to the hospital for medical evaluation. Thank you for watching. Hope it helps someone out there. Subscribe, like and share this video with your friends and family to help save a child. Leave a comment below if you like this video. Never forget this: if not you, who?